Greetings, everyone. Thank you for joining me on this live. This is Wednesday, noon Eastern Time. I'm going to be talking about communication strategies, how we can more easily or more clearly communicate epidemiology to people that we're trying to reach. I asked the question, is it possible? Do you think an epidemiologist can communicate epidemiology without being confusing? Good question, right? We're going to talk about it. Let's talk about some strategies. Strategies for communicating epidemiology. I'm going to talk first about the problem a little bit, and then I'm going to share at least 3 strategies. I'm going to focus on 3. I'm going to try to stick to that. I think when we even struggle as, internally as epidemiologists to explain what we do, now, of course, that was before the pandemic, and the pandemic doesn't automatically help people understand exactly what an epidemiologist does, but it has helped a little bit in terms of understanding, but also added to the confusion. So the first thing I want to talk about is, what is epidemiology? So I'm going to share this with you because we're going to do this together. I went to Google and I typed in, what is epidemiology? And I got a definition here that was, the branch of medicine which deals with incidence, distribution, blah, 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 blah. Okay, that's fine. Then I saw this. What is the simple definition of epidemiology? That's where I want. So I clicked on that, which took me to a CDC website. And look at this, a wonderful, nice, I'm going to highlight it, nice long definition. And I thought, oh, this is great. We're going to break it up because part of this I like, the other part gets a little lost in the weeds, I think. Love you, CDC. Love all my colleagues at CDC. We're all on the same page, but we don't always, it doesn't always come out the way we want it to come out. So let's talk about this. So the first part of that definition that I just showed you from the CDC website says, epidemiology is the method used to find the causes of health outcomes and diseases in populations. I give that a thumbs up. That's simple. That's easy. I even like the second part. In epidemiology, the patient is the community and individuals are viewed collectively. That's nice. I can roll with that. I like it. I think that we can explain that to people. We can use that to describe what we do and what epidemiology means. But then we get a little lost with this next part of the definition. Good intentions. I believe that wholeheartedly. By definition, epidemiology is the study, scientific, systematic, and data-driven, of the distribution, frequency, and pattern, and determinants, causes, risk factors, of health-related states and events, not just diseases, in specified populations, neighborhoods, schools, cities, state, country, global. It is also the application of this study to the control of health problems. Now, this is the simple version, the simple definition of epidemiology. So where I can see, the breakdown makes it really clear. I bet a group of epidemiologists wrote this too. But, you can see where it's not exactly as clear as I'm sure they intended it to be. I'm going to ask a few people who are not scientific to give me some feedback on whether or not they see this as a simple, air quotes, simple definition of epidemiology. Let's go to the next slide. I have a couple more slides. I want to focus on 3 things. These are 3 simple strategies. And I'm not trying to bash on my epidemiology folks. I am an epidemiologist. I feel like, we're family. I can talk about this, but it's a challenge when we know it. When you think about the people who need to receive what it is that we're sharing, we as epidemiologists. So now it's just you and me, epidemiologists. Let's talk for a moment. When we're trying to communicate epidemiology, we get excited about our reports, our data, because we spent a lot of time with all those spreadsheets or running through analysis programs, and we've had to work through all this stuff, and we've got these nice outputs, and we're excited about it. We connect the dots. It matters, and we want to share that with our colleagues because they need to know, right? Our colleagues need to have this data so that they can do what they're going to do with it, and we want to, arm them with all the stuff. What we often fail to remember or kind of put into context is that our colleagues are not always as enthusiastic about all of the stuff that we're putting into these reports as we are. And if they can't use it, and if it's not understood, and if it's not presented to them in a way that they can run with it, then it's not serving that purpose. So think about who your colleagues are and what they think, what they're saying about these reports. What if it's not internal? What if it's your outside of your organization partners? Let's say it's a nonprofit organization that is focused on a particular disease, and they're serving the people, community of people who are either have this disease or interested in this disease, and they need to share the epidemiology with them. They need to be able to understand what we're putting out so that they can then share it with the community, right? Otherwise, it just gets lost. So stay with me. Let's go back to my slides. My first strategy, here are the three I'm going to share with you. The first strategy is to simply care about communicating your findings in a way that helps your partners, your coworkers, really your stakeholders, that helps them to relay that information, to use that information. And it's not that I'm saying you don't care about it, but again, back to what I was saying before, sometimes we can get into the reports and into the data and into all of the work we've put into it, and we're in our little tunnel and we're working all the stuff and we're trying to just get it out. Sometimes we want to make sure we're ticking all the boxes. We want to make sure we get all of that data out there. And sometimes our assumption is that they'll just pick through what they need and run with it, and we're on to the next project. But we really need to care, really sincerely care about communicating your findings in a way that actually helps your coworkers, your colleagues, your partners, the stakeholders. Okay, so think about them. You have to care that they understand what you're putting out. And it's a simple thing, it's a subtle thing, but sometimes that means pausing before running on to the next thing, or pausing before you just spit out the report that looks like the last report, or follow a template, because not everything can be templated. As much as I love a good template, especially for reports, not everything is going to flow from one project to the next really well based on who's receiving it. So care about communicating your findings in a way that empowers them and it helps them to understand and make it useful. Here's my second strategy I want to share with you. Use simple language. That's not easy, I get it, but it's still possible. So when I say use simple language, I can promise you that your health promotion folks and your community health education folks that are specialists and some of your policy makers really don't care as much about your regression analysis or confidence intervals or p-values as you do. Don't let that hurt your feelings. It really is okay. But you have to understand that just because you're spewing all of that out there, and they're public health experts, there may be doctors, have master's degrees, been in the industry for a long time, but if they haven't actually practiced epidemiology since their coursework, they're not going to remember all these terms, and it's not going to mean the same to them as it does to you. So if you're putting that out there, use some simple language to then explain what this means, or remind them of what it means. Make it easy for them. Don't get lost in all that jargon, because like I said, they're just not going to be nearly as excited about your analysis as you are. They're going to be excited about the outcome and what it means for what they need to do with it. So just make it easier for them. I have a special note here because I wanted to make sure I remember to tell you this. Here's something that you need to remember. It really is okay to have more than one version of your reports. So you can have a epi-focused report. You can have output that is from epidemiologists for epidemiologists, by epidemiologists for other epidemiologists, or super scientific people who really need to hear and see those details, because they'll geek out on it as much as you will, and it will mean something different to them. You can have that version. Then you also need to have the version that focuses on your other colleagues who don't need all of those numbers and all that data. You can have more than one version. You can have a version that is to your other public health professionals, because they will know what to do with that. And then you may even have to create a version that is more community facing, like not your colleagues and coworkers, but the non-scientific community outside of your organization. It's okay to have multiple versions of your reports. You can relay that epidemiology a number of ways. So just because you're simplifying it, taking away some of that statistical data, but interpreting it, you can also have that really super geeky version. One more strategy, and that is to make it interesting to them, not just you. At this point of the game, and I can say it because I've been in this industry for a lot of years, 10 years in healthcare, over 10 years in public health, with some overlap in there. Now there are so many options for really nice data visualizations that you have access to. And I'll guarantee you, well, I can't guarantee you that. I'll bet you your organization gives you access or would give you access to some data visualization tools and would be excited if you wanted to learn some of these really more popular software options for data visualization. That is one way that you can help make your statistical findings, the epidemiology, more interesting to the person that you're sharing with. There are things that can help you with graphs and charts and infographics. There's just so many options for really nice data visualization. And I would even go a step further in encouraging you to interject storytelling in your presentations and how you deliver the information. Interjecting the stories will really make it interesting to the people that you're speaking to. Make it about them, not about you. You can say, well, I don't like, doing all that stuff. I can just use this table here is just fine. When you need to think about them and make it interesting to them. Sharing stories are powerful, especially in situations where, personally, I'm thinking about some of the clients where I've done some consulting work like this, and they're a part of BIPOC communities. So when you can take the data and then use data visualization and then share stories to help the Native American population, like share a story about this data and insert the Native American population and talk about this, about as it relates to tribes and as it relates to things that matter to them, then it's going to be more interesting to them than you just spewing out statistics. Things like that. If you're talking about faith-based communities, then interject certain stories as it relates to a church within the community. Make it real and make it interesting to them. So I know I'm stepping on some toes. Some of you are thinking like, oh, I never thought about that. And some of you are like, oh, I can't believe she's saying all these things. I'm not going to do all that. It's too much work. I don't have time for all that. I hear all the different things. But those are the three strategies. I really want you to think about that. Care about, expressing and extrapolating that in presenting to the community that you're intending to reach. And avoid the industry jargon, really think about them, make it interesting to them. Those are some simple strategies. Now, even though what I've said is simple and it seems easy to me because this is what I do. This is the part of consulting that I enjoy, helping my clients communicate epidemiology in a more clear and impactful way that's not so complicated. That is something I thrive on. But communicating epidemiology, it may not be easy, but it definitely does not need to be complicated. So I had fun with this. I hope you enjoyed it. I hope it gave you some ideas and spurred some conversation maybe with you and some colleagues, but it's ongoing. I think there's a lot to be said and a lot to learn, and we're all learning how to better communicate epidemiology. And so you're going to hear more of this from me.